Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine. Well, if you've been injured or in pain from something like arthritis, it's important to know that there are many paths to healing before opting for surgery.
That's right. So today we are talking with Dr. Nathan Yokel, partner at Regenerative Orthopedics and Sports Medicine, about how they are helping patients every day. So Dr. Yokel, thank you so much for joining us. And let's just jump in with why patients would want to come to see you. I'm sure, not just arthritis, but, other ailments bring them in.
We pretty much will take care of anybody. And I think one of the main things about our practice is all of our doctors are not specific to one body part. We treat the whole body. A lot of times these things are interconnected. A lot of times you can't treat one area without treating another. All of our doctors are not surgeons. We're non-operative specialists. So we're really living in that area in between something that is not getting better with rest or with a little bit of time, but also not severe enough for surgery. Sometimes you don't know. So you need to come in so we can kind of give you a direction. But I think we can really help people figure out what's going on, really identify what the cause of the issue is, and then present a real array of solutions. Many solutions typically have been limited to physical therapy, injections to calm things down, and surgery. And that's been the orthopedic regimen over the last 50 years, calming things down or fixing them when they get too far gone. A lot of the treatments that we do can go in between, can really help the body stimulate it to heal itself, can take pressure or alleviate tension off of nerves or scar tissue, and sometimes allow patients to have that outcome that they're looking for without as much downtime or invasiveness as surgery or taking that time off of work.
Well, and I think having that option of maybe not having surgery if you don't have to is something that a lot of people are looking for. And you also work with major insurance, all the major insurance companies, which we should point out. But I want a couple examples of some success stories. And I know there's one that's very personal to you as well.
Sure, yeah. I mean, over the years, we've worked with an array of patients, and we've had some great success stories of athletes getting back to the big game, both professional, high school, and just guys trying to make it out there to their weekend leagues. And we also have patients that can barely walk or take care of themselves, and sometimes those are a little bit more satisfying, even though it might not be as glitzy and glamorous. One of my most important patients over the years has been my mother. There was a period a few years ago where she was dealing with some terrible back and hip issues, trying to remove myself from the situation. I connected her with a lot of good doctors that I trusted. She went to different surgeons. She was not a surgical issue. Went to a hip guy. He said it was not a hip issue. She went to a back guy. He said it was not a back issue. She had various cortisone injections to calm it down, but it wasn't working. Finally, I said, just come in. We're going to figure it out. My mom is very anxious about needles, and so the whole process was a little bit stressful for her, but we have a nitrous oxide machine in the office, so you use like in a dentist office or something like that. So she was able to kind of calm her nerves down. We ended up treating the back and the hip and some other supporting structures with the plasma treatment using growth factor from your blood to stimulate healing. And so she went from really not being able to get around or go upstairs and having to use a walker. This was a woman who was vivacious and active. To a couple months later, she was able to walk. A couple months later, she was losing the walker. And later that summer, was back to playing tennis. And now she's out there bragging on her son. But I swear, this is all truth. And this has been probably one of the most gratifying experiences for me as a doctor, because we all get into it to help the ones we love.
That's wonderful.
And you have helped so many people across the DMV. I mean, you guys are at the forefront of, some of the latest techniques and technologies. So I'm sure there's a lot of people that are in pain and want some other options. How do they go about connecting with you?
Absolutely. I think one of the things that sets us apart is all of our doctors are really immersed in the regenerative world, the world of ultrasound guidance for medicine, to the point where we're teaching nationally at these different conferences. We've been doing these treatments for years, and so a lot of the doctors that are now starting to take on these treatments, which we think is excellent, are a little bit new to it, where we might be the ones teaching them at a conference and teaching all of our doctors these same techniques. So if you come to our office, you're going to get the same experience whether you're in Virginia, whether you're in Maryland, whether you're in DC, whether you're seeing me, whether you're seeing one of the other doctors. You're going to get that complete experience where we're really assessing the issue, giving you that array of options. If you want our advice, we're going to give you our advice, but in the end, we're going to help you decide for yourself once you better understand what's going on. And you can certainly go to our website, which have a lot of information both on studies on how these treatments work and how successful they can be, as well as patient stories about what their experience would be. and some more information about what things are, what to expect, things like that.
Well,
Dr. Yokel, yeah.
Sounds like you, changed your mother's life and, so many other people. It can be game changing, not only physically, but mentally as well. So thank you so much for everything that you guys are doing.
Yes, absolutely. Hope you guys never need us.
Hopefully we don't, but if we do, we know who to call.
Thanks, Dr. Yokel.
Excellent.
Great to see you.